My child will never move close to that child because he has autism. Why? Autism is not contagious. You need to understand that. This is why we have to understand what autism is and the terminologies. So somebody would say the child is autistic. So when you say the child is autistic, it means that you are defining the child first and you are now using disability to qualify him later. So the child and the disability. But when you say the autistic child, it means you are using disability to describe the child. So which means disability and child. I don't like either of the two, but maybe the first is better. However, I would rather say you say a child on a spectrum. The reason is because when you say a child on a spectrum, you are saying that autism itself is not one thing. There is a group of things. It is a compendium that has different things under it. So it could have different disability that your child would not have this actually challenge or a condition, while another child will have this condition. So why is autism a spectrum? Autism is a spectrum because it is a group of the challenges, disabilities, or behavioral problems that have impact on a child. So get that clear. So please, let's say a child on a spectrum. So what is autism itself? Autism is a neurological challenge that have an impact on cognitive development of a child, social interaction, communication, and behavior. So all of these could be impacted, or either of these could be impacted. Going forward, children are born with autism, but it is not a congenital abnormality because it is not apparent at the point of birth. You could only know a child is on a spectrum maybe after 2 years or maybe 18 months, because when they don't meet some milestones in what? Social development, cognitive development, language development, communication, either verbal or non-verbal, motor development, among others. Now, there are major two things about autism. The first one has to do with social interaction and communication challenge, while the second one has to do with behavior or repetitive disposition to a particular behavior and interest. So these are the common components of autism. Going forward, so I have explained why autism is a spectrum. What are some of the things that you could see in your kid that could be suggestive of being on the spectrum? Number one is when a child fails to respond to name. That is a challenge. Another one is when a child cannot make eye contact. It could be suggestive. Another one is the child is not affectionate. He does not know how to receive love or show love or to say I love you or even understand I love you. The next one is a child who loves to play alone, solitary play. That could be a tendency. Another one is struggle with verbal and non-verbal communication. Another one is oppositional deviant behavior. It does not follow instruction and you could easily become frustrated. Another one is intellectual disability because it is a problem that affects the neurons of the brain. Another one is learning disorders. I've mentioned dyslexia, dysgraphia, dyscalculia. Another one is sensory problem. They hate noise, they hate sound, they even hate sometimes you come close to them. Another one is communication problem. Another one, attention deficit hyperactivity deficiency. So when you see many of these things, it could be suggestive of that. Now, one of the things you also have to understand is diagnosis. You cannot be too careful when it comes to spectrum, but what I would advise you is behavioral examination is very important for you to know whether your child is on a spectrum. And then apart from that, developmental milestones. Is it talking when he's not meant to talk? Is it forming a relationship? Is it socializing? Is it interacting? Is it emotional? These are things that are suggestive of whether a child could be on a spectrum. Intervention. Intervention are basically two ways, medical and therapy. Medical has to do with having to go to a pediatrician or an expert that will tell you maybe your child needs drug, because autism could be severe, could be mild, could be moderate. But there is also another type of autism called profound autism. That is a very challenging one. Now, ABA, applied behavior analysis, is a way that you actually learn to help your child through behavior modification by reinforcing behavior you want your child to have. Another one is occupational therapy. When your child has motor problem, with fine motor skills, with the muscles, with the way he carry himself, you could need an occupational therapist. Another one is medical, psychostimulant drugs, where you have to seek medical advice. Another one is behavioral modification. Behavioral modification has to do with you and teachers, because there could also be an educational plan for your child, behavioral intervention plan for your child. Another one is also speech therapy when he's struggling with language. Now, what are the risk factors? Some of the things that you could see in your child when he's on the spectrum: he could have epilepsy, he could have sleeping disorders, he could have allergies, he could have digestive problem, he could have anxiety, he could have depression, he could have cognitive problems, he could also have motor problems, and majorly behavioral problems. Going forward, early intervention. Early intervention that we advise is peculiar to you and myself. Number one, be careful of medication, because many of the medication have side effects that could actually impact you as a man or as a woman. Another one is be careful of your environment. Sometimes environment predisposes people based on chemical substances, among others, to certain challenges and affect the content of our body. medication and food. Be careful of what you eat. Smoking, drinking alcohol, all of these are risk factors to our health. Please, for the sake of the unborn child, let us make the world better by being careful of ourselves and addressing people appropriately. So don't say the autistic child or that child has a problem. No, the child on the spectrum, because he is a child and he can improve. I hope you have learned one or two things. Thank you. This marks the end of our learning disability procedure, special education series, and I'll see you in the next episode. Bye for now.